In large B-cell lymphoma, both autologous transplants and CAR T-cell therapy are efficient options for patients who achieve complete remission after salvage therapy. However, it's unclear which approach offers the best outcomes. And recently, there was a CIBMTR study that shows higher PFS and lower relapse incidence with autologous transplants, which prompted us to address this question in a large real-world study. Using the EBMT registry, we included over 2,000 patients who received autologous transplants and 349 patients who received CAR T-cell therapy, including 28 in second line. All patients were in complete remission at the time of infusion. So in the entire cohort, outcomes favor autologous transplant with higher 2-year PFS and overall survival. Now, if we focus on the subgroup of patients who received axi-cell, there was no difference in terms of relapse incidence and non-relapse mortality and progression-free survival. However, overall survival remained higher with autologous transplants compared to axi-cell. And importantly, with a propensity score match per multivariate analysis, we showed that there is no difference in terms of overall survival, progression-free survival, non-relapse mortality, and relapse incidence when you compare autologous transplants to CAR T-cell. So what's the meaning of all this study? Well, in selected fit and transplant-eligible patients with large B-cell lymphoma who achieve complete remission, autologous transplant is a valid option. Actually, both autologous transplant and CAR T-cell offer favorable survival with a 2-year overall survival of 80% with autologous transplants and 71% with CAR T-cell therapy. So while the priority is to expand the access of CAR T-cell therapy, we believe with this data that it's reasonable to propose autologous transplant in this selected population, very specific, who reach complete remission.